Dr. Rita Smith, the Chief Nursing Officer at Jersey City Medical Center, and we're here today to welcome nurses and the rest of the hospital body to help us celebrate Nurse Week. Nurse Week is always an exciting time. It's a time when we're able to step back and look at the accomplishments of nurses, what nurses mean to patient care in this organization, and what nurses mean to the organization as a whole. Throughout the last year and over the last couple of years, nurses have really been at the forefront of leading quality, safety, and satisfaction initiatives. We're now partners for patients in approximately 10 different collaboratives. We've been very successful over the last few years putting together protocols for care that improve the outcomes for our patients, and everything from sepsis to glycemic control. All of this has been at the institution or the direction or the hard work of nurses, and we certainly appreciate that, and certainly our patients appreciate that. We're a magnet organization, and over the last 4 years we can certainly see that the approach to care in this organization has changed and improved. We now have care that we look at all the time. We evaluate the care that we're providing. We're looking for best evidence all the time. We're increasing our dependence on evidence-based care. And we're also doing things like transforming care at the bedside. We weren't a partner with that 4 years ago. As a magnet organization, we believe that we need to be innovative, and that includes looking at all of the processes and all of the activities of nurses and making sure that we're efficient with our time, that we're using our highly skilled and educated nurses in the best possible way, and improving both the work environment for nurses and therefore outcomes for our patients. My message for my nursing staff today, and certainly during Nurse Week in 2012, is to step back and look at what we've accomplished and to constantly be evaluating what we do and re-energizing so that we can always be at the forefront of care and we can be leaders in the industry of healthcare and certainly in the profession of nursing. Enjoy Nurse Week. Nurse Week's theme is to take nurses taking care of themselves, and I certainly hope that all of our nurses participate in the activities this week. Learn to take care of yourself and enjoy the week.
Jersey City Medical Center achieved magnet status in 2008, and we're very proud of that recognition. Magnet status is the highest distinction that a healthcare organization can receive in regard to nursing excellence and clinical quality. Only 8% of all U.S. hospitals have magnet designations, so it is indeed the gold standard. Magnet status is an award. It's a performance-driven credential. What this means for nurses and patients is that our nurses are autonomous, there's low nurse turnover rates, there's low RN vacancy rates, and there's high nurse satisfaction. Magnet reframes the question, what do you do, to what difference can you make? Jersey City Medical Center would like to extend a special thanks to all of our nursing staff for their dedication and devotion to their patients and raising our clinical standards to the level that they are.
Hi, my name is Brenda Hall, and I'm the Senior Vice President for Patient Safety and Quality Management. I'd like to congratulate all of the Jersey City Medical Center nurses on Nurses Week. I have worked very closely with the nurses here at Jersey City Medical Center for a number of years to improve the quality of care and to improve the safety of our patients and staff. While I am generically a nurse by background, I'm not clinically involved on a day-to-day basis, but I can be assured that at any point, if there are clinical concerns or there are quality concerns on a clinical basis, the nurses bring it to my attention. It has certainly been a pleasure to feel confident that they will do that, to make sure that we maintain a culture of safety and that we continue to provide evidence-based care to improve the quality of our patients' care.
My first day in medical school, the dean addressed the entire class, 180 of us, and made a statement which I remember to this day. And the statement was, there are 180 of you in this class. Each and every one of you is is replaceable. A good nurse is not. So treat your nurses with respect. And I remember that to this day, and I speak to our residents about that and our doctors about that, and I remind myself every day that we're a team. And as physicians, we may spend 15 minutes out of 24 hours with a patient, but our nurses spend the entire day. So it's important to remember that nurses are part of the healthcare team. I can do great surgery, I can write great orders, but patient outcomes really depend on the quality and the caring of our nurses, and that's something which we need to live with today.
Just want to congratulate everybody on Nursing Week. You guys do an excellent job every day. On behalf of all of the surgeons in the institutions, and I'm sure the other physicians as well, we all want to thank you for your dedication and support 24/7. As stated, you guys do an excellent job every day. We get testimonials from the patients on a regular basis on the excellent care that you give them, and we thank you.
Well, the nurses at Jersey City Medical Center are so instrumental to the care of the patients. They not only tend to every need, they have an enormous list of activities that they have to perform on a daily basis. But they're also a source of new programs, new ideas. One of them being the Rapid Response Program, which came from their efforts, which has been just a tremendous addition to the care of the patients for the doctors here. And when we say we're a magnet hospital, I like to think it's nurses that magnetically bring all the doctors to this hospital because they know that their patients are going to get good care. We see it every day. They're really the untold heroes of this hospital.
I'm Dr. Belmonte from the OBGYN department. Been here about a little more than 3 years, and working in obstetrics for over 30 years, I've really come to appreciate what I have here and the quality and the cooperation that I've gotten over the past 3.5 years here at Jersey City with the nursing staff. I can't do any, I can't give any more kudos to the staff. I certainly would like to stand up and cheer them on and encourage my colleagues to bring their patients here, because they're not going to find a better site where their patients are going to be cared for any better than Jersey City Medical Center and their nursing staff.
Happy Nurses Week to all my nursing colleagues. I'm Michael Bissett. I'm the director of the emergency department, and in my department, nursing is tremendously important. Our nurses really get the ball rolling with everything that we need to do, follow up on everything that the doctors expect, and really are true partners in care with the mission of what we do in the emergency department. Without the nursing, none of it will work. It would all just be a lost cause in a very poorly functioning department. So I'm very happy to say that we have excellent nurses here at Jersey City Medical Center, and I'm proud to work with them every day.
At Jersey City Medical Center, we have outstanding nurses in the CCU. Those nurses take care of open heart patients, they take care of any patient with cardiac problems, and they are a phenomenal team. They do a phenomenal job, and taking care of our fresh open hearts. I would have them take care of any family member of mine. The patient care in the CCU after an open heart operation typically is either a coronary bypass or an aortic valve replacement or mitral surgery is outstanding. We have very skilled, very professional nurses. They take really ownership. It's almost sometimes like you're taking care of their patient as opposed to really it's my patient. But so sometimes the team approach to it is outstanding, and they do a great job. I also would like to add that once the patients are transferred from the CCU, they go to the cardiac step-down unit, and they receive exemplary care from the cardiac step-down nurses as well. The nurses make sure that the patients prior to discharge are sent home or to a rehab facility with all the appropriate medications and all of the appropriate follow-up appointments.
Hi, my name is Dr. Suhail Al-Sheikh. I'm the medical director for NICU at Jersey City Medical Center. I would like to express my great gratitude and my thanks for all the nurses on the Nurses Week. Happy Nurses Week, and hope everybody stays strong. And we love all nurses. I mean, the nurses are great. Really, they are the flowers. They are the devotion that I see in my unit.
I'm very grateful and thankful for the excellent nursing care and the dedicated, compassionate nurses that we have here. And I see this and hear this every time I see my patients in an outpatient setting. And that is the first thing they always tell me is we were amazed by the nursing care, the stellar nursing care. And every time one of my patients says that, that makes me more appreciative. Happy Nurses Week!
I've always been very impressed when the nurses in this hospital really take ownership and responsibility for their patients. It really puts the patient at ease, and it really helps all of the other healthcare providers deliver the best care possible. So thank you, nurses, and happy Nurses Week.
Hi, I'm Dr. Mata. I'm one of the pulmonologists and intensivists here at the Jersey City Medical Center. I've been here 12 years. In my mind, the two most noble professions in the world happen to be nursing and teaching. And I can't thank my nurses enough who've been with me all these years and have helped pull me through the toughest situations with some of my patients. And a happy Nurses Week.
Hello. As Director of Critical Care, I want to take this opportunity to thank the wonderful nurses, especially the nurses who work in the critical care unit at Jersey City Medical Center, and to thank them for all the wonderful work that they have done in the past few years. As a Director of Critical Care, I have been working in this hospital for many years, but I have seen a dramatic and significant improvement in the outcomes of the various patients thanks to the diligent and new and innovative work that was started by the critical care nurses. As you all know, the critical care nurses in this hospital for the past few years started a variety of new initiatives. They started code stroke, code heart, code sepsis, palliative care, hospice care, rapid response. These are all various initiatives that were originally thought of and brought forth by the nurses for the patient care. As physicians, we saw the value in their ideas and in their plans and eagerly approved and started working with them. Since this intensive work that was started by our nurses, our outcomes have improved, our patient satisfaction has improved, and the families get a better idea of what's going on to their loved one at the time of their critical illness. Physicians can diagnose, can order treatment, but ultimately the treatment is delivered, patient is comforted, their pain is alleviated only by the nursing staff that is working with them at the bedside. They are the ones who are present with the patient day and night. They are the main information givers to the patient's families who are extremely stressed at the time of severe illness of their loved one. But for our nurses, we would not be able to achieve any of these wonderful results that make us one of the best hospitals in the state of New Jersey. And for certain diseases like pneumonia and stroke, we have some of the best results in the country. I really do want to appreciate the wonderful work they do, the great results they have achieved, and we as physicians and on behalf of patients and their families, I want to thank them for wonderful work that they have done all these years. I do hope this continued collaboration between the nursing staff and the physicians continue, and this place becomes one of those few institutions where instead of a physician giving the care, it is a totality of the hospital system that includes nurses, paramedical staff that take care of the patient. Thank you, and I wholeheartedly appreciate their work, and thank you for giving me an opportunity to thank them. Thank you.
I'm Mary Abbott, and I am Chief of Cardiology at Jersey City Medical Center. I have been out of training for 22 years, and I have lived by a philosophy that I learned as an intern, and that was that nurses are your right hand. And at Medical Center, I don't believe that I can do a good job without them being at my side every time I have a patient contact. They are as critically important in patient care and physician performance as any other physician or any instrument that plays a role in making sure we achieve patient safety when patients come to our hospital. They are there to not only help the physician, but they are there to support the patients and their families, which is so critically important in places like the coronary care unit and the cardiac cath lab, because families wait for long periods of time unaware of what goes on and what is happening with their family member. At the medical center, as in any healthcare institution, nurses are an integral part of how successful we are, not only as an institution, but as a human race in taking care of patients when they are ill.
Nurses in case management are very special people. They really have to be, because they're looking at the whole picture. They not only have to plan with the physicians about the care and for the patient's needs, but they have to creatively coincide that with the patient and the family wishes, the availability of community resources, and then they have to figure out a way to pay for that plan, depending on the patient's insurance and other available resources. Our nurses can get that job done. They are not only clinically astute, they have wonderful communication skills, facilitation skills, negotiation skills. They are wonderful advocates, and all of this is needed to not only help the bottom line of the hospital, but to really get to the best outcomes that a patient can possibly have. We are so proud of our nurses, and we're proud of all the nurses at Jersey City Medical Center. We wish you a wonderful Nurses Week and a year filled with feeling proud about the work that you do.
Happy Nurses Week, everyone. I am so proud of our nursing staff. You guys have done a terrific job. Over the last several years, our outcomes have been extraordinary. I just recently had an opportunity to talk to a patient that many of you may have known. His father-in-law owns a restaurant in town, and he was telling me about the extraordinary care that he received here. He's a guy who was about 40 years old, who had a sudden cardiac arrest, and ended up in our intensive care unit and fully recovered. And I'm just telling you that those kinds of outcomes really make a difference to our community here at Jersey City. So on behalf of our entire administrative team, I just want to thank you for doing a terrific job, for being the wonderful, caring, and kind nurses that you are. And I hope you guys have a great week and a great hospital.